Hello, everyone. Good afternoon, and thank you for joining us for ACES LA August Lunch and Learn. Today, you will be hearing from leaders from three incredible community-based organizations that have recently joined our network of care. We are thrilled with their partnership and excited to bring you their vital resources to your patient population. They are all serving youth and families across LA County and are ready to accept referrals on the One Degree platform. They are here today to share the valuable work that they are doing and to assist you in accessing those services. Before we begin, I would like to remind our audience to please remain muted during the webinar, and this presentation will be recorded and posted on our ACES LA website. We will also host a Q&A session at the end to give you an opportunity to ask our presenters questions and anything else that you want to direct towards them. Now, it's my pleasure to turn it over to Naomi Hogan Williams from the Child and Family Guidance Center for brief introductions. Thank you for being here.
Good afternoon, everyone. So again, my name is Naomi at Child and Family Guidance Center. We serve the San Fernando and Antelope Valley, primarily offering services through our Enhanced Care Management Program, which is a service under Medi-Cal. Joining me is also my colleague, Lorelei Little, and I'll allow her to introduce herself.
Hey, good afternoon. I'm Lorelei Little. I am the Enhanced Care Management Program Coordinator here in the Antelope Valley. I'm happy to be here and happy to be presenting our program today. I'd like to introduce Cecilia Plott.
Thank you, Lorelei. Hi, everyone. My name is Cecilia Plott. I'm the Director of Clinical Services from Helpline Youth Counseling. We're located in Southeast LA, and we provide services to the community in our area. I'd like to introduce Shantibon Martinez.
Thank you so much. Hi, everyone. My name is Shantibon Martinez. I'm the Senior Program Manager with Youth Creating Change, and I am very grateful to be here with all of you and look forward to sharing some resources that I hope you will find helpful for your clients and families all throughout Los Angeles. And with that, I'd love to just jump right in. Usually I would take some time to give you a nice overview about our programming and what resources we have, but we were very fortunate to have ABC7 do a nice little highlight spotlight on our organization. And so I will let them do the talking, and then I will jump in and provide a little bit more information. So let's take a look at our first video.
The prevalence of mental health issues in teens is hard to measure, but research has shown nearly half of high schoolers feel persistently sad or hopeless. One group thinks a message of hope can be shared through the lens of young people themselves. Philip Palmer explains.
I've been feeling sad and want to cry all the time.
Young people sharing stories about mental health as a way to offer encouragement and connection is the mission of Youth Creating Change. The group's signature program, the Directing Change Film Contest, recently honored student-created films, which express the filmmakers' perspectives on mental health and suicide prevention.
It's okay to reach out and talk to others.
Young people are creating these films on their iPhones with limited technology, and they're coming up with genuine, sincere projects intended to reach their peers in a moment when they might be feeling low or at a low point and they need to see this help, and the projects are just amazing.
Sometimes you can feel lost in the dark for a long time.
Youth Creating Change partners with schools across the state throughout the year to provide curriculum, training, and awareness activities that keep young people at the center of their own well-being. The program has seen positive effects on school climates and increased student willingness to talk about important health topics.
I've learned a bit about not only just how to approach people with mental health issues, but if I'm going through a mental health issue myself, to, open up and seek help.
Let's normalize conversations about little hurts so that we're not sweeping it under the rug and hiding it in the closet until it becomes a combustible situation.
Reggie Hernandez is a senior at Highland Park High School, and his film earned honorable mention out of 1,300 submitted across the state. Projects by teens centered on destigmatizing mental illness.
it really brings their voice to life. Oftentimes, adults miss the mark. So I think it's important that sometimes us as adults step aside and hear what the youth have to say about what their struggles are instead of us trying to explain it to them.
I hope people learn that it's okay to speak out about things, about their personal issues, about things that are going on inside, and that they aren't crazy when they talk about it. They aren't just like a voice in the wind. We're listening. We're here for you.
I have a real solution, and this one's not a joke. Get help.
At the height of the COVID pandemic, youth mental health was a topic many adults talked openly about. But with the masks gone, Youth Creating Change knows now more than ever it's important teens never feel alone.
We spoke this message of youth mental health being important, and they believed us. Now we got to follow through, and now we got to continue to show up.
Perfect. So our programs are free, evaluated, and they're evidence-based. They are open to youth and young adults ages 12 to 25, anywhere in California, and we do support youth in all 8 spas. And as you saw, our signature program is called Directing Change, and so that is our film contest. It's our annual film contest where through this film contest and also through our other art contests, we facilitate lesson plans where youth can really learn about mental health. They're trained on how to recognize the warning signs of suicide, how to apply healthy coping techniques, and also how to seek help for themselves and also a friend or family member. The way it works is we have this learn, apply, share model. So the learning objectives are actually embedded into the curriculum and the submission categories. And then youth then take what they've learned, they apply it, and then they create these really incredible, as you saw a few clips, films and art pieces that can be shared out, not only to other young people, but also to families, to parents, to really start those conversations. So our annual film contest, Directing Change, is offered once a year, and it all culminates in this really exciting, fun red carpet awards ceremony where we invite all of our youth to celebrate our filmmakers. That happens in downtown LA. We invite local youth to attend as well, and it's just a really beautiful way to show the power of youth voice when they're really centered in these conversations. And so for our Directing Change Film Contest, we accept 30-second and 60-second short films. We call them PSAs around these categories, these topics. Our deadline is always March 1st of every year. And as you can see, our categories are all around mental health in some form. So suicide prevention, mental health, our Through the Lens of Culture category is a really special one. We encourage films about mental health or suicide prevention through the lens of someone's culture, right? What are cultural strengths? What are some stigma that exists in your culture, and how do you overcome that? We also encourage films in all languages. Our Walk in Our Shoes category is for youth who are in middle school, and so that's more around empathy and really asking young people to walk in someone else's shoes, where they can learn how to support one another and also support themselves and seek help when they need it. And our newest category that we're very excited to launch in September, so next month, which is coming right up, is our new substance use category. And we are working on finalizing our curriculum with some subject matter experts, and are really excited to launch that. There's been, of course, as we all know, a lot of need there, and also interest from our educators and our families who really want to hear from youth about what they need to be best supported. And again, just a few more of our learning objectives. These are really embedded into the submission criteria of our film and art contest. And that curriculum has been independently evaluated to make sure that we're meeting learning objectives. And anyone can really, especially young people, they can read about the warning signs for suicide or what mental illness is, but when they have the opportunity to create a film or art about these things, they're able to do it respectfully and really think deeply about impacting the opinion of other people. That requires a level of involvement that can really provide and result in a lasting impact. And so that's really what we see when youth participate and are part of our contests and our programming. Now, our Hope and Justice Film and Art Contest came about in 2020. We had families, we had people who work with youth, teachers, counselors who said, we love your art contest. We love that it's every year, but the kids need something every month. They want to be more involved. So this is our contest that runs every month. We have a different prompt every month around different topics, and youth are able to process their feelings, thoughts, and through this beautiful creative way, which is through any form of art. So now we're looking at art in all forms. It's offered throughout the year, similar to our film contest. It's ages 12 to 25, free to participate, opportunities to win prizes, which is really great. And it's also a great way to increase accessibility, right? For our film contest, not everyone is into film, but anyone can write a poem, or the language of the youth is TikTok. So we accept TikToks. We receive paintings, podcasts, original music, really powerful pieces. And so we are working on confirming what our monthly prompts will be for this school year, but we can confirm that our first one will be about what I wish my parents and other adults knew, and that's one of our most popular ones. We received the most powerful pieces on that topic, and so every year you say, "Are you going to do that one again?" Because we really love that. And then when we are able to share that out with adults and families and parents and caregivers, it's a really beautiful, powerful way to hear directly from the youth and hear their voice. And so just a highlight of a few art pieces from LA County Youth. All of these are available to view on our virtual art gallery on our website. So I encourage you to check those out. There are so many beautiful, beautiful pieces. And what we've really seen from our Hope and Justice art contest is we get a lot of incredible pieces from LGBTQ youth all over the state, who tell us that this contest really is a safe space for them to process what they're going through, express themselves, and also to be seen, but still maintain a level of privacy if that's what they're looking for. So really encourage, if you have families or young people that you think would benefit from this outlet, this creative outlet, to share this resource with them. And then a little bit more about resources. One of the resources that's very popular is our mental health thrival kit. So these are popular resources among youth, teachers, adults, everyone. Everyone loves these. They include journaling prompts to promote self-reflection, self-expression, positive coping, all in a creative way. So we do have a wait list if you're interested in signing up to receive actual copies of those. We are looking for additional funding to get through our wait list and send those out. Last year, thanks to some funders, we were able to get out about 84,000 of those to 34 different counties in California. But the good news is our digital kits are all available for free online, so you can download those, print those, share those out. The kits are available in English and Spanish, and have also been adapted to Korean American youth and Filipino American youth, which are just really beautiful artwork and pieces there. We're also hoping to adapt these in other languages as funding and sponsorship permits. So if you have ideas for what a kit could look like, or say, hey, you know what, I work with these youth, or we're seeing this need, let us know. We are always looking to expand and adapt. And the kits can be used in many different ways. In LA County, we've seen them be used as part of Suicide Prevention Week activities, which is coming up, or shared with students or young people during, club meetups, or in classrooms, or during counseling sessions, during reflection times. Lots of great uses, and also adults love them. Every time we send them out for youth, we always get a call back like, hey, could you send like 3 more for the staff? We really love them. So. And then more resources. We have a variety of different toolkits, other resources like social media shareables, email templates, lots of really great opportunities to share these youth art pieces and videos. It's a great way to start a meeting or to start a conversation in a group of youth or in a school. As you can imagine, we receive about 1,000 films every year and at least 600 art pieces. So there's a lot of youth created pieces out there for you all to use and share. We also have some really wonderful parent education resources, lesson plans, and activity tip sheets as well. So please do check those out on our website, all for free. And I'd like to just take a moment to share one film from Highland Park. That's Spa 4, and if we could just watch that.
¿Qué pasó, papá? Llegaste a la escuela. Sí, but I told you I didn't want to come to school today. I don't feel...
No seas niña, necesitas estudiar y ser fuerte.
But Dad...
Ponte macho.
Hey, the counselor wants to speak to you. Hey, you wanted to speak to me?
Thank you for coming in to see me. I just wanted to check in on you.
I just haven't been feeling well.
I completely understand. And I just want you to know that this is a safe space.
Incorrect beliefs telling someone to man up or toughen up stem from fear and ignorance. Men are encouraged from a young age to bottle up their emotions and man up, especially in Hispanic households. Speaking out and sharing your feelings is what's truly important. Take a step and talk to someone today.
I hope that gives you a nice idea of some of the incredible films we receive. We received really wonderful feedback from Los Angeles County schools and all spas. So again, we are available to all youth 12 to 25. And if you're interested in knowing how to get involved, we highly recommend that you sign up for our newsletter. That's a monthly newsletter for just staying up to date on maybe the newest prompt that we have, what activities we have going on. And also we share some really wonderful resources that we are always building and sharing out as much as we can on all of the new art pieces that we receive. We're also always looking for judges to help us to pick our best films and best art pieces. So I know you are all very, very busy people, but if you ever just like, you know what, I need something that's kind of soul-filling, we'd love to have you as a judge. So please let us know if you're interested. And of course, we are on 1 Degree. So please refer us to parents, families, schools, educators, anyone that you think would benefit from our work and our programs. And with that, thank you so much for your time and the opportunity to share all of this with you. I hope you leave with feeling hopeful, because really that's the goal of our programs and our knowing that our youth are doing such powerful, beautiful things and sharing with us. So thank you so much.
Hi, everyone. My name is Cecilia Plot. I'm the Director of Clinical Services from Helpline Youth Counseling. So today I'm going to share a little bit about our agency, Helpline Youth Counseling. We're in Southeast LA. We serve the surrounding areas of Whittier, Norwalk, Long Beach, Commerce. So our slogan is, we're a safe place for youth and families to get the help that they need. And our website is www.hycinc.org. So HYC was founded in the late 60s, actually, by a group of concerned parents that were concerned about the youth being involved in juvenile delinquency, drug and alcohol use, and gang affiliation. And from that, HYC grew into the agency that we have today. We provide counseling, assistance to low-income children, youth, and their families. We help to eliminate barriers and create opportunities, and to support and strengthen the families, provide them with resources and resiliency so that they can attain self-sufficiency. Overall, our mission at HYC is to help build individual, family, and community health and well-being, prosperity, and equity, to serve our clients and community with trauma-informed, strength-based, and person-centered care. We work in prevention, early intervention, education, and treatment services. So here's a brief fact sheet about HYC. So we work in the area of education. We provide prevention and education, skill building to youth and families. We provide recreational activities, mentoring, tutoring, gang prevention, intervention, and substance use prevention. We also provide therapeutic interventions through case management and individual counseling, group counseling, and couples counseling. Community building. So we assist with healthcare, insurance enrollment and management, and community organizing for parents of at-risk youth. We have a family resource center, which will expand actually in October. So we will be providing to the community. We have household items, hygiene products, formula, school supplies, backpacks, community service information. We provide services in-home, at our office, and out in the community. And then one of our biggest programs is our behavioral health program. We offer evidence-based practices, trauma-informed care to individuals and families of all ages. So HYC is split into 4 different departments, but I'm going to highlight the programs that we are accepting referrals for on our One Degree platform. So we have, first off, we have our youth services programs, which I'll go into more detail in later slides. We have our behavioral health services program. So these are accepting referrals for individuals that have Medi-Cal. So we have our outpatient mental health services. We serve the ages of 0 to 52. We have our Thriving Together, which is a non-Medi-Cal program for ages 18 to 30. So we provide individual counseling as well as psychological testing. And then we have our school-based non-Medi-Cal program in our Whittier Union School District schools. We provide CalAIM, ECM, and community supports, which is through managed care plans. So we're part of Full Circle Health Network, HealthNet, and other managed care plans. We have our Drug Medi-Cal, which serves ages 13 and up. This is through a Medi-Cal program. We offer individual counseling as well as group counseling and recovery sessions. And then we have our Project Tree program, which is prevention. We do services out in the community at local schools and also in at our office sites. And then we're also accepting referrals in our family services program. So we have CAPIT or CARES program. We provide, this is non-Medi-Cal, so this is free services for individuals that are seeking individual counseling, parenting classes, as well as couples counseling. And then similarly, Community Services Block Grant also provides what we call family support as well as behavioral intervention for youth, and then also parenting classes. And then we have our Domestic Violence American Rescue Plan, where we provide short-term assistance to families that are experiencing interpersonal violence. So briefly, I just want to touch a little bit on some of our programs that we have that we're excited about. Youth services, we have our Dream Resource Centers that are located in our local schools. So for example, Norwalk High School, La Puente High School, Inglewood High School, and one middle school, Fetty Middle School. So what we do is provide a safe space for students to obtain resources and support in tutoring, help with homework assignments, or youth supporting clubs. We also provide them hygiene kits and snacks for all students and culturally focused events, which is incorporated into our Stop the Hate grant, which is works with bullying prevention and providing a safe space for all cultures. We do different activities with the teens in our Dream Resource Centers focused on this. And then we have our YSB program, Youth Services Bureau, that's funded through the probation department, where we provide students with anger management and life skills classes. We have I went over our behavioral health services. So these are all Medi-Cal, for Medi-Cal recipients. So we provide individual therapy, family therapy, and SUD counseling. And then we have our family services, so our CAPIT program and our community service block grant. It's for non-Medi-Cal recipients. And then we also have Housing First, which we provide assistance to survivors of domestic violence, and our family preservation plan that helps to keep children out of foster homes and stay with their family members. And then more youth services programs, we have prevention education program. What they do is they provide, they go onto campus, they provide life skills curriculum, as well as raising awareness of the dangers associated with the use of substances, including marijuana, alcohol, methamphetamines, and prescription medication. They also do a lot of social media campaigns with the students. And then we have our diversion and community collaboration program. Diversion, we help to prevent students from going into the juvenile justice system. And then with our community collaboration program, we help to raise awareness regarding the misuse of substances in our community. And then we have our homeless and housing support services. We have our housing navigation that helps individuals to obtain housing and ensure a safe and stable living environment. We have our Metro street-based outreach program, which we have professionals that go out onto the Balloon Line route from Slauson to downtown Long Beach every day of the week and provide assistance to individuals experiencing homelessness. We provide them with meals, identification documents, and shelter referrals. And as far as where we're headed for the rest of the year is to definitely continue to build our service area and our outreach to the community. Like I said, we do have our Family Resource Center, which is a building. In October, we're going to be providing a lot more services to our community. All right. Thank you, everybody. Thank you for being here, and let me know later if you have any questions.
Hi, everyone. So we're going to talk a little bit about the Enhanced Care Management Program at Child and Family Guidance Center, and have Lorelai join in with some additional information as well. So some background about our center. We've been established since 1962, focusing more so on mental health services, primarily therapy and psychiatry. But over the years, we've noticed that there's more of a need for social aspects of our clients. So we've developed numerous different kinds of programs to help our clients with additional needs that they might have. Enhanced Care Management is our newest program, allowing us to extend services past what we've offered previously, so we can help with healthcare coordination, pregnancy, postpartum services, linkages to various supports like housing, food, transportation, education, and more. So just to give some background on exactly what Enhanced Care Management is, sometimes you'll see it referred to as ECM. It's the Department of Health's way to address social determinants of health. We're offered under Cal Ames, so it's nice to see Cecilia also has a program at her organization. Essentially, the Department of Health has recognized that there are various social determinants to mental health or medical health, such as housing issues, transportation issues, education needs. If those things are not in line, then that's going to directly impact their health. So Enhanced Care Management allow for program managers to help coordinate those various different needs so that there are no barriers. So essentially, it's a way to provide wraparound services for our Medi-Cal population. So our approach is a whole person approach because evidence has shown that this is a way to see the most positive outcomes for our vulnerable population, specifically those who have Medi-Cal. We serve a very wide range of demographics. So we like to have person-centered care, understanding that each person, each client, each family has unique needs. And then also making sure that we're acknowledging their ethnic or cultural background, their social economic background, and being very responsive for that in the way that we approach our care coordination. And then making sure that we check all of the services that they need, address any gaps that they might have, whether it's medical related or social related. So our program at Child and Family Guidance Center is partnered with LA Care, Anthem, and Kaiser specifically to offer these services. and we provide support in San Fernando and the Antelope Valley. However, ECM is offered all throughout California, all throughout LA Care. So if there are any clients that come to us and they don't fit into LA Care Anthem or Kaiser, for instance, if they have HealthNet or something other, we can refer them to another ECM program or walk them through how to self-refer to an ECM program that is most aligned with them, their needs, and their location and the plan that they have. It's important to note that for our general Medi-Cal recipients, they do have to enroll in a managed care plan because that's how all of our services are provided to them for free. So we get a lot of foster youth, for example, who have general Medi-Cal because they move from location to location. So we're always happy to walk the case managers or the individual themselves on how to enroll into a managed care plan so that any ECM program, whether it's us or another program, they are able to access the services for free. So here are the general qualifications to qualify for ECM specifically. So you have to be a foster youth. For our program, we can serve foster youth up to 26 years old. If a person is over 26 years old, there are adult ECM programs that are available to them. In addition to that, if you're not a foster youth, but let's say you have a complicated medical need, whether that's a rare genetic disorder, autism, it could be various different things that will qualify, then you will also be able to be referred to an ECM program. We serve up to the ages of 21. If you have recently been admitted into a hospital in the last 6 months, more than 3 times, the system, like your insurance system, will automatically get triggered and you'll be referred to an ECM program, or sometimes a case manager or social worker at the hospital may refer you so that we are helping you follow up with any of those needs so that you are avoiding unnecessary hospitalization or utilizing the ER room. We also help with mental health or substance abuse needs. Those that are homeless, you will automatically qualify for ECM. And then pregnancy or postpartum are the only ones that we can serve for any age, but I will allow Lorelai to speak a little bit more about that.
Yeah, so for the birth equity population, it's specific. There is, as you see here, we can serve any age, but it is the infant mortality, it's for the ones that have the highest infant mortality rates and that are at the most risk. And that is identified by the state of California as Black, American Indian, Alaskan Native, and Pacific Islander. So some of the things that we try to do with that population is, provide community supports, either during their pregnancy or postpartum, helping them prepare for recovery from labor and delivery, helping them find housing if they're unhoused or at risk of loss of house, food related needs, or just going to an OBGYN appointment or finding a doula, because that is a covered benefit now with Medi-Cal. So I just want to say that here in the Antelope Valley, this is a subject that's this populational focus is near and dear to our heart because we in the Antelope Valley, as many of you know, we're a resource desert. We have one of the highest infant mortality rates in the county. It was around, at one point it was around 11 per 1,000 births. And for Black infants, it was around 18. We don't have the latest numbers, but we're still the highest in the county. Some of the reasons out here, if anyone is from this area, you know that we have a shortage of primary care providers. We only have one birth center out here for all the residents here, one birthing center. We have socioeconomic barriers out here, transportation barriers, access to care. As you know, SPA 1 is one of the largest areas out of all the spas in Los Angeles County. So it's a wide range. So getting around, access to care is really difficult for our community. I'm happy to report we are, there's a lot of good things coming. We are getting, I think there's something, there's a birthing center called Kindred Space that's, in LA. They're coming out here. They're trying to, build a center out here in Lancaster. We had the AIM, African American Infant and Mortality, Maternal Mortality Initiative. They are focusing on some of the disparities for, Black pregnant and postpartum mothers. So there's good things going on, but this is why it's so important here in the Antelope Valley, for as an example. Of, so I'll let Naomi continue on.
So this is a nice little variety of services that we offer. So understanding that Medi-Cal can be so hard to navigate, and there's so many services and benefits that sometimes people are not aware of. What our care managers focus on is making sure we help our clients navigate what they qualify for, knowing what doctors or services are available. Sometimes we might help them make appointments, so we model for them what that looks like so that by the end of our time, they're able to be empowered and understand how to do this all independently on their own. For any of our clients who are referred to us due to hospitalizations or get hospitalized or enter the ER during our time with them, we usually see our clients for about a year. Then we just help make sure that they understand what's needed afterwards, any kind of medication or prescriptions that they have, and we guide them through the process. If they're an inpatient facility or they need help transferring to another facility, we will make sure that that's done as well. We also typically coordinate with doctors as needed so that we're closing the loop with our clients' needs. Lorelai did a lot explaining about pregnancy and postpartum services, so those are available. And then in addition to the medical needs, we always make sure that we touch on housing, food, transportation, and making sure that any social needs in the household are provided. Most of our clients are under the age of 21, but we do like to support the caregivers or other household members because that has a direct impact on our clients. So when the children are enrolled in our program, essentially the parents get the help and the support that they need as well. Even if that means education opportunities or employment opportunities, whatever's going to be helpful for the betterment of the child and the household as a whole, we like to link them to those services. So just to put this all into context, I have a sample case provided here. So a lot of our clients are the little ones, so we coordinate primarily with the caregiver. So usually that's mom or grandma or dad or foster parent. A lot of our referrals do come from the community-based organizations that we're partnered with, but sometimes we'll get referrals directly from the doctors or the insurance companies. We are a mental health center, so we provide in-house mental health services. But if a client comes to us and that's not their need, then we will refer them out to other organizations or places where they can get all of their services met. Again, we only serve LA Care, Anthem, and Kaiser clients, but we can refer them to other ECM members if needed. So when we deal with our young little ones, a lot of times they do have complex needs, whether that's a complex medical need or mental health need. And so that typically requires accommodations in the schools. So we help a lot of our families understand the IEP process, getting an IEP, understanding what those services look like, and walking them through it so they can self-manage on their own once our time with them is over. A lot of our families also struggle with financial needs, so we'll help enroll them in any kind of financial assistance programs that they qualify for. We do a very thorough assessment with them to make sure we have a clear understanding of what they qualify for. So if there's anything that we can't offer in-house at the center, we will refer them out to services. And through the ECM program, they have access to so many different kinds of services that are helpful for them. On here, I also made a mention of regional center, which I think is important because regional center is also a very common request and service that we help with. So we'll walk them through the application process from beginning to end and making sure that they get all their services that they qualify for and they understand how to navigate that system. So here's an example of some of our ECM services that are offered to them exclusively because they're enrolled in the managed care plan and have ECM. So housing navigation is one of our popular services. They'll have access to so many different kinds of housing navigators as community supports. So they'll also be able to get housing deposits for first-time rent or security deposit. They're able to get access to necessary items like an air conditioner, heater, a hospital bed if they need one, and things in that nature. Another popular resource is the medically tailored meals. So we see a lot of our children who might have diabetes. And so this is a way for them to get free meals delivered to their home, paid for free by the insurance company, which are healthy. It's only for 9 to 12 weeks, depending on their insurance, but it does allow them to get a jump start in understanding what kind of meals they should be eating. And then after that, we just make sure we create a plan so that they're able to access the equivalent kind of meals, either from another organization, food pantries, or things in that nature. And then a lot of times we get children with asthma. So we do offer asthma remediation programs. They can supply different kinds of equipment in the house or replacement of things in the house for our children with asthma. So this is just a small menu of the many services that ECM offers that we can help them navigate. So once we complete our comprehensive assessment, which usually takes up to 4 sessions because we ask so many questions, again, to make sure that there's no gaps in their care and their needs, we create goals with them. We prioritize what's most important. So they're typically 2 to 3 main goals. So whether that's school accommodations, applying to regional center, linking them to housing, we'll make sure that all the goals are met before we close the case. So most of our cases are for a year, but for some of our families with a lot of complex needs, we are able to extend it past a year if needed. The biggest part of the role of our care managers is just making sure that they link them to supports, they understand the supports, how to navigate the system, because we want to empower them to be able to be independent. But there are some times where we need to hold their hand a little bit more. So sometimes we are able to attend an IEP meeting with them so that they have that extra support in place, a doctor's appointment, making sure that we understand what the doctor needs, and that they understand, or arranging translation services or transportation services if needed. So if you want to refer to us, we are also on 1 Degree. These are our categories so that they can get the support that they need in ECM. We also have our flyer and our QR code, so you can contact us directly if you want to follow up on a referral from 1 Degree. You can email us, you can complete this QR code, and a care manager or Lorelai and I will be in contact with you within 2 business days typically in the last slide. So that's our information. Thank you.
You all so much for sharing information and resources about your organization. That was amazing. I'm Celia. I'll be running the Q&A for the last couple of minutes. It looks like we have about 10 minutes left, so we have time for a couple questions. I'm gonna first start with questions that were pre-submitted. And then I can move on to any questions that were submitted during the webinar or can be still submitted. You can submit questions via the chat, the Zoom Q&A function, or just raise your hand and I'll call on you. It looks like many of our questions that were pre-submitted are not directed at a particular organization, so I'm just going to throw them out there and maybe we can popcorn to any of you all if you have answers. The first one is, what types of services are available, like PCIT, CBT, EMDR, etc., and how do you determine which modality is best for the patient?
I can start. So at our outpatient services, our therapists are certified in several different types of evidence-based practices. So it depends on their age. So for example, we have clients that are 0 to 5, and we use child parent psychotherapy, and that's if a child has experienced some type of trauma. And then as you know, trauma focused CBT is also an option for that age group up to the age of 18. So usually if a client comes in and they have an identified trauma and symptoms related to it, then we will place them in an EBP that focuses on trauma. But we also have EBPs that are focused on anxiety and depression, for example, like individual CBT, we have interpersonal psychotherapy. So it really depends on what the client's presenting with and then also what their treatment goals are.
I can move on unless any of you all want to answer that as well. I will move on. Do your organizations diagnose mental health disorders as well?
Yes. Yes, mine does.
Yes,
Ours
ours
does
as
not.
well.
Which one said you do not?
Sorry.
That was Youth Creating Change.
Okay, great.
Sorry, Lorelai.
Wanted to be clear. Thank you. And the next question is the criteria for the referral and what is the criteria for the referral and whether or not you take insurance or not, and what service areas they cover. I think most of you, all of you, have answered the service area question, but maybe just the insurance.
So for our programs, it depends on the program. So our outpatient or drug Medi-Cal, we accept Medi-Cal insurance. And then our family services programs, CAPIT and community service block grant, there's no requirement, but there is an income requirement. And community service block grant, they have to reside in a certain area, which is surrounding our agency in Whittier, of Norwalk, those areas, and have to meet a minimum income requirement.
Yeah, China Family Guidance Center also accepts Medi-Cal specifically for the ECM program. So Elicure, Anthem, Kaiser.
Thank you, thank you. Let's see, we have a couple more. How often can patients be seen specifically in an area of psychiatry?
So we do have 2 psychiatrists that we contract with that see children and adults. We typically see them when they start out once per month. And then depending on how they're doing, they might move to every 3 months.
Great. And then the last question is just about the referral forms and what email to refer to.
They would be accepting referrals on the One Degree platform.
I was going to interject and say that.
Yeah.
Thank you.
And each organization has a landing page that has more information about the services that they accept referrals to, and their individual websites are linked on the One Degree page, landing page, so you can get more information there as well.
Thank you, Julie. And that's everything. Thank you all again. Thank you so much for your incredible resources and information. We're looking forward to seeing you all at the upcoming Lunch and Learn, September 17th, from noon to 1, as per usual. Look out for emails announcing the subject. And please remember to follow us all on Instagram. Have a good last 3 minutes. We'll give it back to you. Thank you.